In this morning's Health Watch, back pain. It affects 80% of Americans at one time or another. And exercise may be the key to getting back on your feet and staying there. Here with some simple exercises to help ease that ache is Dr. Holly Phillips. Holly, it is great to see you.
Great to see you too, Russ.
Why is back pain so common?
You know, really for two very simple reasons. The first is that it's so easy to injure your back doing everyday activities. That means lifting light things, driving, even sitting at your computer. And the second reason is that once you've injured your back, it's so easy to re-injure your back that it becomes a very dangerous cycle.
You touched on this, but the common causes of this, somebody doing something they shouldn't do, lifting something?
The primary cause is just muscle strain, muscle overuse, and muscle injury. But there can also be issues with the spinal column itself, with the bones within the spinal column and herniated discs. So there are a number of reasons that we can all end up with back pain.
Looking at an x-ray right there on the screen, what can you tell us about this in terms of where back pain normally occurs?
Well, this is an x-ray of what we call the lumbosacral spine, or the low back. And what we really focus on when we're thinking about back pain is that space in between the bones. This space in here is called the intervertebral space. Now, this is a healthy spine, but in somebody who has back pain, we might see a narrowing of that space. That can be from a herniated disc or from osteoporosis, fractures, and what that does is it compresses nerves as they come off the spinal column and causes excruciating pain.
Oh, gosh, okay, let's talk about some of those exercises that we mentioned earlier. Swimming, a great way to alleviate back pain. What does it do? What does it do to the muscles?
Well, swimming is just a great low-impact activity, but I have to warn back pain sufferers. The idea is not to be Michael Phelps. You know, what we really want to do is just do some light walking in the pool, some floating, very light strokes if you want to do some laps in the pool. What you should avoid is twisting exercises. They can hyperextend the low back and make any injury worse.
I see.
But ultimately, it's great. It increases our flexibility and really helps to heal those muscles.
As you said, don't go crazy in the pool. All right. Walking, you say, can be great as well.
Sure. That, again, is just a low-impact aerobic exercise. We have to keep in mind aerobic exercises help our muscles to use oxygen more efficiently. And well-oxygenated muscles really are less likely to get injured. So not only are we helping our back pain, but we're also preventing it going forward.
Okay. Knee to chest exercise. You said that's great for the back as well.
Yeah, it is. Particularly, now, if your back pain feels better when you sit down, knee to the chest is a very, very good exercise for you. It stretches out your low back and strengthens what we call the core, or the abdominal muscles. That whole thing makes your spinal column more secure, more stable, and you're less likely to get injured, and you'll feel better.
Good to do this stuff, obviously, before you work out as well, just to kind of loosen up the muscles and that kind of stuff. But the last exercise we're going to talk about is called bridging. What is that exactly?
Well, bridging is an extension exercise. We do a lot of it in yoga. It's ideal for people whose back pain starts to feel better if you're standing up and walking. Then you should do this a few times a day, maybe 2 or 3 minutes, a few times a day, and you'll start to see those muscles strengthen, and you'll start to experience less pain.
Bottom line, some of this stuff you can't help, but obviously you want to tell people don't do anything crazy. Don't start lifting stuff and things like that.
Absolutely not. Just a few minutes a day, and also get clearance from your doctor beforehand. There are some injuries that should strictly be rested, but for the most part, if you have back pain, staying active will help you.
And age not necessarily a factor.
Not at all.
Okay.
It affects everyone.
All right. You feeling good?
I am. But I've got a little back pain, actually, now that you're mentioning it.
Holly's expecting.
Yes, 1 month left.
All right. Congratulations to you, and thanks for coming in. For more tips on managing your pain, you can go to webmd.com and search back pain.